At Allina, the words of our mission statement begin, "We serve our communities." We're very proud to provide ALF with this proposal.
One of the biggest reasons why I decided to get a job at Allina is they go the extra little effort to make sure, you know, our patients have their purse and the doors are locked before we leave, and they do all that little stuff that makes a big difference to these people that are having probably the worst day of their lives.
We have to be perfect, and all the dispatchers here come to work and strive to be perfect every single day.
An amazing senior management team, an outstanding operations team. We have clinical service folks as well as quality assurance, unlike anything that I've seen in the business, and I've been doing this for 21 years.
Our ability to respond is incredible. We have been training. We put it as a priority to train all of our people how to respond in those situations and how to follow a system of management.
They got emergency managers in place. They're using an executive on-call system so that nothing's really coming at you out of the blue.
And we have so many people that work for us that we can get all kinds of help in a heartbeat if we need it. And not only to help at the scene, but also to make sure that the other communities aren't uncovered while resources are being focused at the problem.
They work side by side with our personnel very well. I think one of the keys is not only the competence and the training of the personnel that respond in Allina is certainly very well qualified, well trained, and we have a lot of confidence in them, but it's how well they team and they work together with the other first responders.
We don't come in and control the scene, but we are able to just, you know, put these resources and move patients. We move patients, that's our job.
If you were to talk to a mechanic at Allina Medical Transportation about what kind of work they do, they would tell you that they're in the healthcare business. And they're part of delivering healthcare is to make sure that ambulances are maintained absolutely at the top peak working order, and they come off the street before they break down so that preventative maintenance can go on. And so when they're in service for a reason. They're there, they're dependable, and a mechanic sees their work, properly so, that they're actually taking care of patients.
Allina Medical Transportation cares about its community, cares about its people, cares about its employees, and I think that shows in how the paramedics and the EMTs provide care to the communities themselves.
Our community recognizes Allina as an important partner in our community. They know that Allina is there for us, they know that Allina is there for them.
A high priority for the city of Prior Lake is providing a safe and healthy community to our residents. The things we do together, Allina and the city of Prior Lake, personify that every day.
Wherever I meet an Allina ambulance driver, I like to hug. They came and saved my life, and I'm forever indebted to the service of the paramedic and the driver from the ambulance service.
Not only is it important to respond to emergencies once they occur, but to understand why they occur and what can be done to actually prevent them. And so Allina Medical Transit has done bicycle helmet courses. They get out in the delivery of CPR so that more people are actually saved. They deal with young drivers, where young drivers get into trouble. They have got an amazing track record of actually trying to drive this preventative agenda.
When we started Level 1, which was an ST Elevation program 5 years ago, it was immediately known that the EMS world played the biggest part of the whole system. So not only pre-hospital identification and quick treatment, but also then transfer in, was the only way we were able to accomplish great outcomes in great times.
We were early adopters of CPAP, or a breathing technique that has helped the congestive heart failure patient not get intubated, which has decreased their hospitalization rates, their intubation rates, their death rates, and other illness rates associated with that, and save costs at the same time too.
They are our direct extension out there, and nowhere has that been more valuable than in our Level 1 myocardial infarction program. We've started to have them pre-activate the system, meaning they diagnose the myocardial infarction in the field. Allina Trans took part in a very large multi-center national study looking at the accuracy of their ability to diagnose acute myocardial infarction in the field. They were accurate or correct 90% of the time, which is as good as you're going to find in any ER. And the most important finding of that was that of all of those EMS systems that were represented, the system with the highest degree of accuracy was Allina Transportation.
I hope you enjoyed our brief tour of Allina Medical Transportation, where we serve our communities by providing exceptional care.